Good morning and welcome to today's event brought to you by the Agriculture and Rural Development Sector Coordination Group here in Myanmar. Thank you for your patience as we have started a little late this morning. My name is Katie Webley. I'm the Fund Director for the Livelihoods and Food Security Fund, and I will be today's moderator. First, of course, many thanks to the International Food Policy Research Institute, IFPRI, for hosting and managing the preparations for today's webinar. The event is now being recorded and will be posted on the IFPRI Myanmar website. So this is the fourth in a series of webinars hosted by the Agriculture and Rural Development Coordination Group on the impacts of COVID-19 on agri-food system and rural communities. IFPRI and the University of Michigan will share 3 presentations today based on phone surveys funded by USAID and LIFT to assess the impact of COVID-19. Today's researchers will turn a spotlight on poverty and food security, on maternal and child cash transfers, and on nutrition, and propose recommendations on how to protect Myanmar's vulnerable households. We are honoured to have with us today government officials from the Ministry of Agriculture, Livestock and Irrigation, and from the Ministry of Social Welfare, Relief and Resettlement, who will open and frame today's sessions, as well as reflect on the research findings and recommendations. The last 30 minutes of today's session is dedicated to your questions to our guests. So please feel free to submit your questions to the panel via the chat box at any point during the presentations. So to start today's events, I would like to welcome U Cho Shui Lin, Director General for the Department of Planning at the Ministry of Agriculture, Livestock and Irrigation, to provide some opening remarks. U Cho Shui Lin, the floor is yours.
Yeah, greeting from Naypyidaw. Good morning, everyone. Name is Katie, Pambo Director, LIFT, and Iran, and Dr. Isabel, Research Fellow, IFPRI, and distinguished guests, ladies and gentlemen, very welcome and welcome you all. It's my great pleasure to be here with all of you. Even we cannot meet each other in person, we can communicate virtually on the seminar of assessing impact of COVID-19 on food and nutrition security in Myanmar. Allow me to exchange my sincere appreciation to the organizers for giving me an opportunity to deliver the opening remark in this auspicious occasion. In July 2020, we have been celebrated at a seminar of assessing the impact of COVID-19 on Myanmar's crop value chains. I would also like to express my sincere gratitude to all speakers for kindly sharing your time and sharing their valuable experience with us. All of us know COVID-19 poses a serious risk of health of Myanmar's population as well as the all over the world and economic challenges. Some of impacts on the economy were declining household income, increase in unemployment and declines in remittances. Then necessary lockdown measure in April also have serious economic consequences, resulting hardship for both rural and urban population. Therefore, the government of Myanmar quickly launched a COVID-19 economic relief plan for all sectors, but also efforts to protect households such as necessary tariff exemption, measure to ease financial burdens such as loan repayment, emergency food rationing through community-based food bank and association, and unconditional cash and in-kind transfer to vulnerable and risk population, including top-up benefits for motherland and children cash transfer recipients. Like other viruses, COVID-19 has shown its very harmful ability to cross borders and continents. I would say that COVID-19 outbreak is a test case for all governments' response and mechanisms, as well as endurance of our people. All of us know that the situation can change very quickly, as we haven't seen positive cases in Naypyidaw over the past days. Even we currently in the containment phase, our public health care response across the country with increased number of COVID-19 infection. Yesterday, more than 250 positive cases already found. Over the past days, we suppose that COVID-19 were not serious effect to food production and food supply chain, except destruction of commodity flows and market assets. However, it is difficult to expect when we can have stable situation unless vaccine is widely used all over the world. Therefore, we need some assessment study, such kind of the crucial assessment study are important, or we need to have if the virus spread continue. I believe that we will be able to share experience and seek the solution on three critical important issues such as impact of COVID-19 on income, COVID strategy, food security, and dietary diversity. COVID-19 disruption to health and nutrition service in urban areas and whether previous recipients of cash transfer and nutrition-related training have better food and nutrition security outcome during COVID-19. I strongly ask all of you to work together for combating COVID-19 negative impact. Thank you very much. Katie, the floor is yours.
Thank you, Josh Whalen, for opening for us today. Our first presentation today is on poverty and food security impacts, given by Dr. Derek Heddy. Derek is a Senior Research Fellow with the Poverty, Health and Nutrition Division of the International Food Policy and Research Institute. Over to you, Derek.
Thank you, Katie, and thank you to all those attending today. On behalf of IFPRI, we really appreciate your involvement here. So yeah, this presentation is going to be on assessing the impacts of COVID-19 on food and nutrition security in some selected samples in rural and urban Myanmar. We'd like to thank USAID and LIFT for financial support and moral support, and also researchers from Michigan State University and the University of Michigan and IPA for helping out with survey implementation. Next slide, please. So I just want to give you a quick little overview of the research team. We're really going to present three different studies today. The IFPRI or MAPSA team is myself, Isabel Lambrecht, Tanza Wu, and Sophie Goudet, who will also be speaking. And then there's the legacy evaluation team working on the rural component with Elisa presenting today, but also Erica Field, who's worked on that study in the past. The Meme evaluation team, which helps apply the urban sample, involves Russell Toth and Andrea Di Micheli. And the IPA survey implementation team is led by Tanza Wu, Afke Yeager, and Ricardo Morel. Next slide, thank you. So as we all know, and as was mentioned by the DG, C19 triggered a truly global economic crisis with almost universal economic contraction predicted. In the World Bank economic projections from June essentially said that almost no low or middle income country would be spared from economic contraction this year. A global modeling study by IFPRI estimated that 140 million people could become poor in 2020. And Myanmar, of course, was relatively lucky in some sense in that it was experiencing very rapid economic growth prior to March, when the COVID-19 crisis started to fully affect the national economy. But COVID-19 imposed both severe international shocks on trade and remittances, while C19 prevention measures caused sharp economic contraction during the lockdown periods, especially in April, as was shown by an earlier IFPRI study led by Jinshen Jiao and colleagues. Jiao et al. Also projected large increases in unemployment. Around 5 million people could have lost their jobs during the lockdown period in April. And also they projected declines in household income on the order of 20 to 30% from April to June. Next slide, please. These forecasting models are obviously really critical for early assessments. They were able to be done very quickly, still during the lockdown period, and they're very helpful for assessing the likely magnitudes and also the mechanisms of economic impacts in terms of the types of sectors and livelihoods that are being affected. However, survey data on household welfare is obviously essential for monitoring actual income effects on the ground, and also for understanding responses that are not easily captured in economic models. These include coping mechanisms. How are people trying to adjust to these income losses? Also more subjective or psychological welfare measures, including things like stress. and as well as access to government and non-government assistance, particularly in terms of social protection. It's also critically important to assess the impacts on food and nutrition security, especially for households with pregnant women or young children. And as you'll see in the presentation below, some of the results we find are a little bit surprising on this front and could certainly not easily be envisaged by standard economic models. Next slide, please. Research finds that economic shocks during the first 1,000 days of life are really important. They increase the risk of wasting. So a recent study, which I led with Marie Ruel, we looked at a number of countries over the last 20 years and looked at the effects of economic shocks. We found that it significantly increases the risk of child wasting, which is a major risk factor for child mortality. And in one of the policy notes we've produced as part of MAPSA, we assessed these risks for Myanmar specifically. It's also known to increase risks of stunting. Stunting, of course, in early childhood is a very strong predictor of poor health and cognitive development, lower educational attainment, and also lower wages in adulthood. So that can have very serious long-run consequences for human capital development. And of course, these risks and also other risks associated with income loss increase the risk of child mortality, as a study by Baird et al. Showed several years ago. COVID-19, though, is a bit unusual, of course, as a complex crisis. It's also increasing the risk of health service disruptions. This could include reducing antenatal, neonatal, or postnatal care, which is very important in the first 1,000 days of life. And Sophie's study today will assess some of these disruptions. And it's also unusual in causing food system disruptions. And this could affect either the supply, for example, through transport restrictions, but also demand as consumers change their responses to normal purchasing behaviors because of fear of contracting contagion. Next slide, please. To quantify the impacts of COVID-19 on economic, food, and nutrition security, we conducted a survey of over 2,000 women in late June and early July 2020. The survey is both a household survey in the sense that we ask a number of questions about the household as a whole, and it's a survey of mothers. The survey of mothers is also unusual in that we have quite an interesting mix of pregnant women, women who have just recently given birth in the past month or so, and also mothers of young children, typically under the age of 5. So it has two unique features in this regard. The urban sample consists of mothers who were all pregnant in January 2020. They had attended antenatal clinics in Yangon. And so they're giving birth through the course of the COVID-19 crisis. And today we're only presenting results from the first round in June, but there'll be subsequent rounds through which we can track both pregnancy and childbirth. And the rural sample was also unusual in that it was part of a randomized control trial of the maternal child cash transfers program that ended in mid-2019. So one of the studies today is going to assess the sustainability of those interventions. Next slide. So today we're going to share results from 3 separate studies. They're all making use of different survey features. I'll talk first about the impacts of COVID-19 on poverty, coping strategies as well, food security and nutrition security at the household and maternal level using the full sample, both rural and urban. And I'm going to stratify a little bit by both asset levels or asset poverty and also by the main livelihood in the household. Then the second study will be led by Elisa, looking at the impacts of the MCCT exposure on food and nutrition security in the rural sample. So this study is a little bit different in that it's more experimental in nature. And then the final study will look at prenatal, neonatal, and postnatal health and nutrition service disruptions in the urban sample of mothers who are either still pregnant or have recently given birth. Next slide. So turning to the first study on poverty and food security impacts, we're going to assess the poverty and food security impacts on households with young children or pregnant mothers. These are often very young children. And as I said, we will stratify results by rural and urban location, by the main livelihood for household incomes, and also a measure of asset wealth. There will be a discussion paper released soon, most likely in the next week or so please look out for that. Thank you. Next slide. So the survey design I've gone over a little bit. We have roughly 1,000 women in urban Yangon and peri-urban Yangon, 1,000 women in the rural dry zone. there's a lot of modules in the questionnaire, but the modules we're primarily going to use here are estimates of monthly income, both in January and June. So January is taken as a pre-COVID baseline. Not all mothers can recall January and June income. So about 75% of our sample felt confident enough to report incomes in January. And then we use that income measure to calculate a $1.90 per day poverty headcount. So it's important to note here, this poverty measure is not comparable to the poverty methodology used by the CSO, because that's based on household expenditure, which is actually preferable, but of course it's very time consuming. So in this phone survey, we could not ask about all the different expenditures that the household is undertaking. So this is an income measure. So it's fundamentally quite different to the CSO expenditure measure. Nevertheless, it's a useful metric for understanding the recent income that households are receiving. We also ask more qualitative measures about COVID-19 economic, social, and health impacts. So we're not just relying on this monetary metric for 75% of the sample. We're using a series of qualitative measures too, among other things, in order to account for things like seasonality, because seasonality is potentially problematic for measuring income in agricultural households especially. So we're going to ask things like, how is your income compared to this time last year, in order to account for that seasonality issue. We also ask standard questions about coping mechanisms, but also about external assistance, both from the government, from NGO, and from private charities as well. And then we're using the food insecurity experience module, a series of 8 or 9 questions asking about food insecurity experiences, but with different degrees of severity. So we'll cover that, at least in brief, in this presentation. And then finally, we're going to look at maternal dietary diversity based on the number of food groups that a mother consumed yesterday, where an adequate dietary diversity for a mother is defined as consuming at least 5 out of 10 food groups in the previous 24 hours. And that metric has been shown to be a fairly strong predictor of micronutrient adequacy. Next slide, please. So the first key result, we just asked a qualitative question if respondents could name the 3 most important impacts of COVID-19, and those different impacts can be classified into economic impacts at the bottom of the graph that covers income, jobs, food supply, shop closures, and travel restrictions. And then a series of social impacts, sort of anxiety over staying indoors, no visits to family, friends, household arguments. Health impacts, which were sickness itself. So very few households said they'd experienced any sickness related to COVID-19, as expected, given the survey was in June. Fear of sickness, though, was more common, and then also health service problems. And of course, the most striking result from this graph is that incomes and job losses were, by far the most frequently cited problem. 84% of urban households and 75% of rural households cited this as an issue. So, it's very clear that the economic impacts are affecting a very wide range of households. Fear of sickness, sort of an anxiety measure, was also very common, 42% in rural areas, perhaps reflecting insecurity over access to health services, compared to just 28% in urban areas. In terms of some of the other findings, travel restrictions were cited by roughly 1 in 6 households. Interestingly, food supply issues were cited much more frequently in urban households, 20% compared to just 10% in rural households. And this is a finding you'll see throughout our results, that urban households feel much more food insecure in general. Next slide, please. Second key result, COVID-19 has led to major losses in household income and rising income-based poverty. So the table here refers to estimated changes in income and also income-based poverty from January to June 2020. And if you look at the bottom of that table, you'll see the full sample, the median income change from January to June was 34.4%. So median incomes declined by over 1/3 in this 6-month period, of course, which is really striking. That translated into a 26.9 point increase in the $1.90 per day poverty measure. There are some variations across livelihoods and location. The change in poverty was higher in urban areas, 31.9 points compared to 21.9, even though urban households started off with higher income. So it seems like maybe there was more damaging effects in urban areas, which is perhaps not surprising given that farming is considered to be a somewhat more resilient sector in this crisis. However, we do see that lots of farmers said they didn't have any income in June. That could be to do with seasonality, but unskilled labor and skilled labor both saw large increases in poverty, and trade and retail also as well. So these would be households that are maybe not normally poor, but because of prevention measures and maybe demand side disruptions, trade and retail households really saw large declines in income and large increases in poverty. So just some other statistics cited here on the left. As I said, we sort of tried to triangulate between qualitative and quantitative measures. 80% of respondents stated that COVID-19 led to income or job losses. 18% reported no income in June. They basically said they had zero income in the month of June. 2/3 reported income declined over January to June. 77% say that the June income was lower than normal. So this sort of suggests that it's not just seasonality, and that there's obviously much more severe disruptions and unusual disruptions going on in the economy in the first half of 2020. And just over half say that income was primarily lower due to job loss. So for those households that reported lower income, we said, what was the main reason for income loss? And over half said it was basically either loss of an actual job or less demand for their work for those people that are essentially selling their labor. So as I said, median income fell by 1/3, poverty rose substantially, and it seems like farming and labor-based livelihoods were the worst affected. Next slide, please. This is a graph of the distribution of income in January, that's the black line, and the distribution of income in June. And you can really see very dramatic shifts here. In January, the income distribution looks as we would normally expect it, sort of log normal. Average incomes are above the poverty line, and very few households reported zero income. But in June, you see this unusual large increase in the number of households reporting little or no income, and a large increase in the number of households that are earning less than $1.90 per day, or about 840 child. Thank you. Next slide. So we also used a regression analysis to try and understand what explains households moving into poverty between January and June. So there are a series of factors that are just, fixed household characteristics. Here we're focusing on things that changed between January and June. And perhaps no surprise, given the qualitative results, income lost from by basically losing a job or losing fewer hours worked was a strong predictor of moving into poverty. It increased the risk of poverty by about 10 percentage points. But also, if a household lost, or if a household's migrant lost a job or had less work, that had a similar effect of increasing the risk of poverty by around 10 percentage points. And then interestingly, the other factor that was very strong in explaining movements into poverty, essentially in the urban sample, was just having a child. So if a child was born last month, that increased the risk of poverty by 13 to 14 percentage points. And that suggests that women mostly are working during pregnancy, but then they have to stop work during pregnancy, and they're not getting, they're typically not getting any income after childbirth. So that obviously has important ramifications for social protection and other policies. Thank you. Next slide. Fourth key result, the poor coped with these income losses mostly by taking loans. There were other, people cited diverse strategies, but if you look in the table here, in the asset poor group, over half of households took loans, also roughly about half in the asset low, whereas just 31.8% of the asset-rich households took loans. In contrast, richer households tended to reduce savings and they tended to reduce non-food spending. We found that, about 14% of households reported reducing food spending, but again, that was much higher in among urban households. 16.6% of urban households reduced food spending compared to just 10.9% of rural households. So again, there seems to be more food insecurity in the urban households in this particular context. In addition to this, on the next slide, if you could turn to the next slide, please, Michael, we also asked about receiving government assistance in the past month. Government assistance was by far the most common. Relatively few households reported receiving assistance from NGOs or private charities, although private charities were more common in urban areas than in rural areas. Among those receiving any kind of assistance, 31% of households said, of rural households said they received assistance compared to 25% in urban. If you look at reports of receiving assistance by asset levels, 35% of asset poor households reported receiving assistance, 27% of asset low, and 19% of asset rich. So it does seem like the distribution of assistance was pro-poor, although it still seems, a number of households that were asset rich still received some form of government assistance. So I think we need a little bit more research to try and understand these patterns a little bit more and exactly what kinds of assistance they received. So more work on this will be forthcoming. Next slide, please. Key result 6, despite less poverty, at least to begin with, urban mothers had much higher food and nutrition insecurity. So food insecurity experiences were typically twice as prevalent among urban respondents. If you look at the bottom of the graph on the right, for example, there's a metric of times in the past month when fewer food types were eaten. So did mothers or households sacrifice dietary quality and dietary diversity? This figure is 21.9% for urban households, but just 9.6% for rural households. And then the next metric above that, times in the past month when less food quantity was eaten, a similar sort of ratio where at least twice as many urban mothers were reporting this experience of food insecurity compared to rural mothers. In addition, we see that same pattern borne out with inadequate maternal dietary diversity. 1/3 of urban mothers had an inadequately diverse diet, so very high compared to 15.7% of rural households. In addition, COVID-19, the income job losses indicator, was a robust predictor of food insecurity and inadequate diets. So we can say with a fair degree of confidence that the households that experienced income or job losses from COVID-19 saw a deterioration in both food security and nutrition security. Next slide, please. The last key result, we look at this same metric of dietary diversity, but we split it up into the different food groups to try and understand, what's happened to the consumption of different food groups. And again, we're running a regression of consumption of that specific food against this measure of COVID-19 income or job losses, and seeing how that metric of income or job loss predicts the probability of consuming a specific food in the last 24 hours. And as we'd expect, there's no effect of income job losses on the probability of consuming rice, the main staple in most of the country. But we see for every other food group, all of them nutrient dense, nutritionally important, we see a lower probability of a mother consuming that food if she reported income and job losses at the household level. And the effect sizes are relatively large for some of the most micronutrient and protein dense foods like eggs, meat, fish, but also legumes like nuts and seeds and beans, and vitamin A rich fruits and vegetables. So this is quite concerning because I think it suggests that the COVID-19 economic shocks may be increasing the risks of micronutrient deficiencies, even though of course we can't directly measure those micronutrient deficiencies through phone surveys. Next slide. So in terms of the recommendations, we have 3 sets of recommendations from these findings. The first pertain to social protection and economic recovery. I think the recent COVID-19 outbreak in Myanmar shows that recovery is probably going to be slower than expected and also interrupted. It's pretty essential, therefore, to build a more comprehensive and effective social protection system that's going to be central to a resilient economic recovery and preventing households from falling into and staying in poverty traps, and also for preventing really severe malnutrition. Clearly, employment effects are one of the main mechanisms by which this crisis has affected household welfare, and labor-based households need much more work. I think there should be a discussion about scaling up conditional cash transfers, and those could also, of course, include returning migrants. For farms and small and medium enterprises, managing the trade-off between credit and indebtedness will be important. Of course, it's probable that for many households, accessing loans or credit is a very important way and quite effective way of coping with the crisis. But there's also a risk that households could be taking, excessive debt or taking debt at very high interest rates, which is, trapping them in a cycle of indebtedness, which will also cause poverty traps and prevent recovery at the household level. However, more research is needed to understand the pros and cons of these sort of credit-based coping strategies. Next slide, please. There's obviously strong implications given our focus on surveying mothers of young children and pregnant mothers for nutrition-sensitive social protection. I think we all need to explore options for scaling up and sustaining cash payments in the first 1,000 days, especially for mothers not currently covered by the MCCT program, which I believe at the moment only covers 5 states and regions, with further scale up to follow. And there's also a question of whether we can guarantee entitlements to social protection through legislative actions by making access to social protection a right. It's important to track which mothers are also receiving one-off cash payments. So our understanding is that in September this month, mothers who were not covered by the MCCT program were able to access one-off cash payments through online or phone systems. But it's important to try and understand, how well whether mothers are knowledgeable about that and how many mothers are accessing it, and how that varies by livelihood and geography and so on. Another finding is that the income loss from childbirth is really significant. So mothers who gave birth during the COVID-19 crisis experienced more income loss at the household level. And strikingly, giving birth to a child even pushes some households into income-based poverty, which is really concerning. Finally, poor diets among mothers who recently gave birth shows that nutrition education is still important. So clearly there are strong cultural beliefs about the foods that mothers should eat immediately after giving childbirth, but those could be seriously increasing the risk of malnutrition, particularly micronutrient deficiencies. So there's a really strong role for behavioral change communications here. But the question is, can that effectively be delivered through ICTs, particularly phones, in the context of the COVID-19 contagion? Next slide, please. My last slide. Clearly, we also need more monitoring and evaluation of both the emergency measures that are part of the CERP, as well as social protection. The CERP was necessarily implemented very quickly and was quite comprehensive, but as of the moment, little is known about who benefits from different interventions. Clearly, these phone surveys can help to some extent. Our results suggest the poor are more likely to benefit from government assistance, but only 1/3 of asset poor households said they received assistance in June. Further surveys may be able to track whether that indicator improved or deteriorated over subsequent months, but it does suggest that quite a few households that are very vulnerable haven't really received government assistance yet. It's also important to assess the types of transfers made and the impact of transfers on household incomes and food and nutrition insecurity. So that's all from me, and I think now we'll turn over to Elisa. Thank you.
Thank you, Derek, for that presentation. May I encourage everyone again, if you have questions on the research, on the analysis, on the slides, please put your questions into the chat box, and we'll be sure that the panelists answer them towards the end. With those 7 key results, you'll have noticed that all recommendations lead towards social protection. So let me also remind you that after the 3 presentations, we have the Director of Department of Social Welfare, who will also be here to respond to these. So please also add questions if you'd like to frame them towards him. So on that, on to our second presentation, which is on the sustained impacts of maternal and child cash transfers. Will be given by Dr. Elisa Maria Murfioli. Elisa is the Assistant Professor in the Department of Health Management and Policy at the University of Michigan. Elisa, over to you.
Thank you, Katie. Perfect. So I'm going to tell you a little bit more about the sustained impact of maternal and child cash transfer. We were able to follow up, as Derek explained before, former recipients of the maternal and child cash transfer in the rural dry zone, and I will tell you a little bit more also about the program per se, but in practice we conducted a randomized control trial to provide experimental evidence of the effectiveness of the maternal and child cash transfer program on nutrition, especially stunting rate. And through this study we were able to follow up the same sample and test whether the benefits of the program were sustained during the COVID crisis. And next slide, please. Just to give you a little bit of background on the LEGACY program. LEGACY stands for Learning, Evidence Generation and Advocacy for Catalyzing Policy. The eligible beneficiaries of the program were pregnant mothers in their 2nd and 3rd trimester, living in selected villages. And as part of these villages, we delivered 2 kind of main interventions. The first one was providing monthly cash transfer to these mothers until their child turned 2 years old, with the idea exactly of covering the critical window for child development, the first 1,000 days of life. And the second element of the intervention were monthly social and behavioral change communication campaigns, SBCC, I will refer to it as SBCC going over, where basically supplemented cash transfer, covering a range of topics related to nutrition and child health. It was a package of kind of information in that sense, delivered through mothers group, influential caregiver groups in the communities, as well as individual counseling for those mothers more at risk. Next slide, please. So the program again focused on the first 1,000 days of life with the scope of reducing stunting and in general improving nutrition on mothers and children. The program was implemented through kind of designed through our partner Save the Children, that we thank for the support and the help through the program. And we also work with the Myanmar Nurses and Midwives Association to enroll beneficiaries and the local in the microfinance institution that helped through the delivery of the cash transfer. The program was implemented between 2016 and 2019 in the dry zone in Myanmar. And then through our research partner, Innovation for Poverty Action, we were able to design an impact evaluation of the program through a randomized control trial. So as you can see in the slides, we randomly selected different villages in 3 groups. The first one is a control group. Basically, nothing happened, no intervention was conducted, no cash was delivered, no SBCC was implemented either, and life was normal. In the second group, we deliver only cash transfer, and in the third group, we supplemented cash transfer with social behavioral change communication. So the design of the program allows us to look at the causal impact of cash versus cash plus SBCC compared to not delivering this program. Just to give you just to give you some sense of what we find before moving to following up these recipients, we do find that really what mattered for reducing stunting was cash plus SBCC. So we do find that that in villages where cash plus SBCC was delivered, the proportion of children stunted was much lower than the other 2 groups, the cash only and the control. And when we explore the mechanism through why we do see so big reduction in stunting, we do find that there was improvement in dietary diversity, breastfeeding and washing practices, as well as prenatal care and food consumption. Next slide, please. So I just want to share with you 3 main key findings following up this subsample of recipients of this program. So the first funding really look at food insecurity, and we asked people whether, in this case, I just report 3 of the indicators, but for example, whether they worry about not having enough food to eat, whether they were unable to eat healthy and nutrition food, and whether they were eating less than what they thought they should be. What you can see in the graphs in the slide is that food insecurity is statistically lower in the cash plus SBCC household compared to the cash only, as well as the control group. So the blue bar refers to the cash plus SBCC. As you can see, the proportion of people reporting each of these food insecurity indicators is much lower than the two, the other intervention group, the cash only and the control group. Next slide, please. The second funding really look at kind of the sustained impact on household and women dietary diversity. The first 2 graphs on your left side look at the dietary diversity score of the household and the women. And what you can see is that the dietary diversity score is statistically significant higher for the cash plus SBCC group compared to the cash and then control group. And then when we look at the women minimum dietary diversity, whether they eat up to 5 different type of food categories in your right side of the screen, you can see that the results are kind of in line again, and basically the percentage of people of women having minimum dietary diversity is much statistically significant higher in the cash plus SBCC compared to the cash and the control group. And the results are particularly show kind of large effects in terms of magnitude. In fact, there is a 21 percentage points more likely to achieve minimum dietary diversity in the cash plus SBCC with respect to the control group. So we have about 46% of mothers with adequate diversity in the cash plus SBCC versus 25% in the control group. Next slide, please. Thank you. The key findings really look at preventive COVID practices. Just as a reminder, we kind of find in the legacy, in the impact evaluation of the legacy program, that mothers also change their hand washing practices on different dimensions. So we also ask here during COVID what they were doing to prevent COVID. These are just, again, some of the indicators, whether people were washing their hands with soap, they were wearing gloves, they were asking people from outside to wash their hands or even change their clothes when, or they were even changing their clothes where they're coming from back home from outside. So what you can see is that there are statistically significant differences between the cash plus SBCC and cash versus the control group. But the effects are really small on side, so the differences are really within the range of 1-2 percentage points. And this also suggests that there might be, as we find in the legacy program, there might be some spillover effects in terms of practices from the cash plus SBCC to the cash villages. Next slide, please. So just to conclude, we did find that former recipients of the maternal and child cash transfer that we evaluated back in 2019 tend to have a better food security and dietary diversity, especially if they not only receive the cash transfer, but they also receive nutrition-related education, the social behavioral change communication that we deliver. These results are consistent with the fact that there are extra benefits of having nutrition-related education of mothers and people in the community, and not just delivering cash transfer. We still think, in line with these results and what Derek suggested before, that there is scope to explore the safer platforms like exploiting technologies or mobile phone to deliver these education messages that really can have an extra benefits when combined with cash transfer. As the last point, I think these results, even if preliminary, and again, we will explore the future rounds and see whether these impacts are sustained even longer. But in general, I think all this funding really point to the fact that maternal and child cash transfer helps build kind of nutritional resilience. And so it's important to think about how we can continue or even accelerate the scale up of maternal cash transfer, especially suggesting that the previous study and this study show that the program is an effective intervention for improving food and nutrition security. Thank you very much. I will go over to you, Katie.
Thank you, Elisa. Thank you. Okay, and so on to our third and final presentation of the research findings. This third presentation is on nutritional care services. It will be presented by Dr. Sophie Goudet. Sophie is a researcher and a senior technical advisor of nutrition, currently working with the International Food Policy Research Institute. Sophie, over to you.
Thank you, Katie. I'm very happy to be in this webinar today. So my presentation is going to be on nutritional care services in the context of COVID-19 in urban and peri-urban Yangon, Myanmar. Nutritional intervention, access via ANC platform, and nutrition practices are very important during pregnancy for women to remain healthy, to have a positive pregnancy experience, and also to decrease the risk of complication. But equally important for their babies during their 1,000 days, that way they're born healthy and have less risk of poor health outcome. Globally, COVID-19 crisis and its response has disrupted health services, often because health services have been overstretched, but also because of some measures in place, such as lockdown measures or physical distancing, that are difficult to deal with when you need to do counseling, for example. In Myanmar, surveillance data from DHIS2 gave indication that there was a decrease in coverage in the number of pregnant women registered in April 2020, and also a drop in coverage of immunization against tetanus for pregnant women. Even before the pandemic, poor urban women in Yangon were less able to access quality and timely nutrition services via ANC platform. So my presentation is going to be looking at first services, so access via ANC platform, and at delivery and health facility, and then looking at maternal nutrition practice and breastfeeding practices for babies. So next slide, please. So, the results presented today use the first round of a multi-round survey. So the round one was collected in late June, early July in 18 townships of Yangon, with approximately 1,000 respondents and mostly pregnant women. So 698 were pregnant women, and were for 80% of them in their last term of pregnancy. The remaining of the respondents were mothers with babies born within the last month. We collected household level data on socio-economic status, the severity of COVID-19. We had data also on maternal child health, and collected information on health service disruption. We disaggregate the results when relevant according to asset group, and we compare the results to Myanmar DHS 2015 and 16 with recognize the limitation to do that, and as we do not have baseline data for this survey. Next slide, please. So the first set of results are on services, and we found modest reduction in access to essential nutrition services and receipt of nutritional counseling. 70% of women in their last term were able to access to receive 4 ANCs, and that's a little bit less than what was reported in DHS for urban area, but very limited number of pregnant women were able to achieve the 8 recommended contacts. Yet 50% of pregnant women reported some direct disruption of ANC visits. So you can see the chart on the right side, disaggregated by asset groups, that women reported as the first reason that the appointment was postponed, and as second reason, the appointment being cancelled, and with the asset low group reporting a higher proportion of appointment being cancelled. When we looked at content of ANC visit, we found that there was no major impact and that most pregnant women did receive the full package of services, with counseling and with monitoring of weight gain during pregnancy also received, which are two key intervention during pregnancy to promote good nutrition practices, but also to identify women who are nutritional risk by not gaining enough weight or gaining too much weight, just no weight during pregnancy. Iron, folic acid, or multiple micronutrient supplementation, including iron or folic acid, are very important. Is a very important recommendation. IFA should be taken daily as soon as possible throughout pregnancy. And here we found that 97% of the women reporting taking daily IFA or MMS during pregnancy. For women who just gave birth, 8% reported that COVID-19 did change their delivery plan, but overall the majority still gave birth with skilled birth attendants and also gave birth at health facility. And this is really important, as we know that giving birth in the right environment and being supported by a skilled birth attendant increase the risk of the chance of good health outcome and the risk of risk at birth. Nevertheless, women in the poorest asset group had less assistance by doctors and also were more likely to give birth at home, and this is also in link with what was previously reported with the DHS 2015. 64% of women who just gave birth received counseling on feeding practices, and the majority was at the health facility, so for 52% of those. But very little did receive counseling via phone, so only 3% did report receiving messages via phone. Next slide, please. So the key results, number 2, is on maternal diet diversity, as measured by the number of food group consumed in the last 24 hours. So if women eat 5 or more, their diet is considered as diverse. We found that, as previously reported by Derek, 34% of women did not eat 5 or plus, so they did not have a good diet. And when we looked at status and we compare women when pregnant versus women who just gave birth, we found that 63% of women who just gave birth did not have an adequate diet. And this is a really striking result. And there can be many explanations for this and more analysis is needed to understand better. But we know from previous research that knowledge around maternal diets during pregnancy is quite limited by women and also by their husbands. We also know that there is cultural bias during after birth, and that food-related taboos are common after birth. But as Derek pointed out, the loss of income from childbirth could explain also decrease in purchase power and decreased ability to have a diverse diet. When we compared the two groups and what they ate in the last 24 hours, we found that women who just gave birth had a much less micronutrient-rich diet. So they consume less orange and yellow fruits that are very rich in vitamin A, but they also consume lots less of milk and dairy, which are important sources of calcium. In terms of higher rate of inadequacy, we found that women in the poor asset group had higher rate as well, and that women who reported COVID-19 having the greatest impact on their income had lower rates. Likewise, women who did not deliver at health facility. Next slide, please. So the last set of results are on breastfeeding and on early initiation of breastfeeding. So this is breastfeeding less than 1 hour after birth, and this is very important because it reduces the risk of neonatal infection and death. Compared to DHS, we found a lower early initiation of breastfeeding overall, but also much lower in the acid poor group. See on the right side that only 56% of babies were early initiated at early initiation of breastfeeding. When we looked at a little bit older children and when breastfeeding was guaranteed, we found that there was very limited disruption. So only 1.3% of mothers reported stopping or changing in breastfeeding because of fear of COVID-19 transmission. We also found that there was limited reported avoidance of certain food groups because of COVID-19, so only 2% reported this. Now on low birth weight. So low birth weight is when babies are born with less than 2.5 kg, and it's an important predictor of survival and health outcome. It's also very much associated with poor maternal nutrition and poor access to health during pregnancy. So we found that almost 1 in 10 babies were reported to have low birth weight in our sample, and this needs to be taken with caution because we were not able to confirm the birth weight. As this is a phone survey, we asked what was the birth weight at birth, but we were not able to confirm. We found also that 23% of reported low birth weight babies were not breastfed, and this compared to 1% for the babies normal at birth, and also that they were less benefiting from less early initiation of breastfeeding. We also find higher rates in Langtaya Township. So again, all these findings need to be taken with caution, and with the next round we will be looking more into this data on low birth weight to understand better and have better confidence also in the results. Next slide, please. So moving on to the last slide on the recommendations. So our finding confirm intra-health inequalities in urban areas. It also gives us an indication of some level of disruption of COVID-19 on services and practices. So very important to continue maternal nutrition services and also to reinforce remote nutrition counseling with the current situation and the increase of COVID-19 cases and potential protracted lockdown condition. Remote counseling, use of mass media or social media are very important to continue counseling women during those key time during pregnancy and during lactation. Effort also needs to be strengthened to promote initiation of breastfeeding in vulnerable group, as we found that there was that poor urban women were less likely to have good breastfeeding practices at birth. We also found that the early initiation of breastfeeding was lower in health facilities, so skin-to-skin contact between the infant and the mother immediately after birth should be reinforced in health facilities, obviously to start lactation early, but overall to protect breastfeeding practices in times of crisis. Dietary diversity for mother in postnatal period needs to be tackled. We need to understand the barriers and need to find ways to promote increased dietary diversity during this key time when lactating women need to have a good diet to avoid risk of malnutrition. Finally, nutrition sensitive social protection in poor urban area needs to be strengthened. We call for inclusion of and prioritization of certain area and very targeted MCCT in areas of Yangon with either full elasticity or one-off cash payments. We also would like to discuss potential increase of disbursement just after birth to tackle potential decrease of purchasing power at that time. And also with the current condition of increase of cases of COVID-19 and likelihood of not being able to access services in a traditional way, that messages are delivered via phone or apps. So that's it for me. Thank you so much, and over to you, Katie.
Thank you, Sophie. Thank you very much. So I'm very pleased to introduce now our last panelist today. U Cholintin is the Director for the Department of Social Welfare in the Ministry of Social Welfare, Relief and Resettlement. We would like to invite U Cholintin to share his perspectives on the research findings and the recommendations, or indeed any comments on the current context of social protection for Myanmar's vulnerable households. U Cholintin, just to tell you in advance, many of the questions and comments that are coming in are also asking about conditional cash transfers. So if you have any comments you'd like to share about the Myanmar strategy and your approach to unconditional versus conditional, that would probably also be very helpful to the listeners. Thank you very much, and over to you for your comments.
Okay. Thank you so much, Katie, especially for inviting me to this webinar discussion as a panelist on behalf of my Ministry of Social Welfare, Relief and Resettlement. So before I make my comments or feedback on the studies, so let me respond to your question about conditionality and conditionality. So yes, there is a big debate, especially when we implement cash transfer program, whether it should be conditioned or unconditional. So this debate is not just about in Myanmar scenario. So it is a global debate. State we are convincing. So conditional cash transfer are better, or unconditional cash transfer are better. So for me, especially for the people who is implementing cash transfer program in Myanmar. So I especially for this given situation, and for this and that this socio-economic factors. So I would suggest, I would recommend unconditional cash transfer is more appropriate in this time with challenging factors. So the reasons are the first point is implementation capacity and money capacity of the implementers, and the second reason is the capacity of beneficiaries to fulfill their obligation. Like there will be like two conditions for receiving benefit, then they will have to fulfill these conditions. So for that to be fair, we need to make sure that they are in the position and to fulfill these conditions. From if we look at from the beneficiary side or demand side, and there's a issue as well at the supply side. For example, like AN service. If we make AN service as a condition, then they must have facilities, health facilities, in their village or in the village around them. Otherwise, that won't be fair to make that point as a condition for receiving cash benefit. So basically speaking, so we need to have an environment to introduce conditions when we talk about cash transfer program. So that is my response, my response to this issue of conditionality or unconditionality. So then then let me move to the studies that we just had chance to listen from this presentation. And thank you so much, for this wonderful presentation. And based on my observation, so I noticed, actually there's a three studies. The first, study, mainly, talks about, the impact of, COVID-19, especially negative impact of this pandemic, on poverty and food security and nutrition. And there were findings and recommendation as well. So later on, I will be commenting on these findings and recommendation as well. And the second study is impact of the previous MCCT beneficiary exposure. Basically, that was about program implementation designs, and basically like control and then and then cash allow and then cash plus idea. So how basically cash plus idea was how effective it was, and comparison as well, that what I noticed. And the third study was nutritional care services. So that is more relevant and to MOHs, I think. For me, then let me move to my comment on the study. Mainly the first study. So actually, generally speaking, when people face income loss or when they lose their jobs in this pandemic or in other shock situation, and majority of people, they will have to choose negative coping strategies, because they don't have any other choices. Then they will have to choose negative coping strategies, like for example, like they will have to reduce the quality and quantity of food they will take. So actually this pandemic has multi-dimensional negative impact, not only on nutrition, for other aspects as well. But here let me focus on nutrition and nutrition related their socioeconomic aspects. So as I said earlier, definitely they will have to choose negative coping strategies, like reducing the quality and quantity of food, and as the consequences. So there is very serious and dangerous consequences of using or of choosing this kind of negative coping strategies. Like it can lead to nutritional issues, especially among very young children. And very young children, it can lead to the long-term negative impact on their development, brain development, and other physical development, physical growth as well. So that is the most visible impact of this pandemic, from the consequences of using negative coping strategies when they face challenges like job, when they face income loss, and when they face when they lose their jobs. So here the most important point is how government intervene, and how society intervene in for this scenario. I believe all of you will notice what government is doing. I will have to refer COVID-19 economic relief plan. Actually, that is not just about nutrition, not just about social protection. So that is very comprehensive response to this pandemic at the national level. There's that other components, but cash transfer plays a big role in responding this pandemic. So if you look at CRP, there will be you definitely you will see activities for or intervention of cash transfer program. So Ministry of Social Welfare, we are implementing immediate cash transfer or basic cash transfer program for those vulnerable people across the country. In doing so, we have regular cash transfer program and in Chin, Rakhine, Naga, Kayin, Kaya, Shan, Ayawadi. And for those beneficiary receiving regular cash transfer program, what we did was we gave an additional cash benefit as a top up with the support from Lift. And then after that, now we are expanding, or we are implementing one-time cash support for those pregnant women and who are living in non-cash transferred area like Yangon, Mandalay, Sagai, and Mo, Tanendai, and Magwe, and Kachin State. So this is what we are doing. And then let me talk about the recommendation from the study. So yes, I found these recommendations are very very useful and interesting. And the one point is to make sure more responsive social protection system. Yes, we also realize that we need to improve our social protection system to be more shock responsive. Yet for the time being, I sincerely speaking, we are not that shock responsive, but we also clearly understand that we will have to improve it in future. We need to respond in more responsive manner. And then we cannot predict how long that will when COVID-19 will leave us. So since now we are working on that, then and then suggested or recommended about conditional cash transfer that will be more effective. So as I said earlier, in this challenging time, so that will be very difficult to introduce conditional cash transfer program. But what we can do is along with unconditional cash transfer, we can provide key messages for our beneficiary, like nutritional, educational, and hygiene messages. So that kind of, we are doing that kind of messaging through the digital platform. And then recommendation, and I noticed that the proportion of poor household receiving government assets, that is just about 1/3. That is the findings. But I believe that proportion will definitely begin higher in this September, because we are providing cash support to those pregnant women and this month. And then then let me talk about second presentation, second study. So as I said earlier, basically that is about program implementation design. So that is good, and I found this interesting, and we also we have taken note very well on of the defining from this study as well. But I don't think in this challenging time we won't be able to apply this kind of implementation arrangement. But definitely we will be thinking how we can use this kind of design in the normal, in our regular program. And I have to say that it is very interesting. Yeah. And for the third study that is more relevant to MOHS, since it is about nutritional care services. So that is what I like to comment on the study. So Katie, shall I move to the question, or what is your suggestion? Thank you so much.
Yeah, thank you, Jolinton. That was really excellent to hear your overall reactions to the studies, as well as touching on some of the questions. At this point, I would like to ask all of the panelists to turn on their webcams so that we can see you all. We have sort of 7-8 minutes until 10:30. I believe that we will continue as long as there are listeners listening, that we've had 150 or so more throughout the session, but understanding that some may drop off at 10:30 since that is the scheduled time. We've had really so many questions come in through the chat box, and I've been batting them to one panelist or another. We will not get through all of them, so what we will commit to do is to make sure that we answer the questions and put the full Q&A up on the IFPRI website. So what I would like to do is to cluster them a little bit, and if we can start with Derek. There are a cluster of questions that are more around the methodology and the scope of the urban, the rural, how you identify asset poor and so on. If I could start with asking Derek to provide a few comments in response to some of the methodology questions that came in, and then Elisa can do the same following that. Over to you, Derek, to take a first go.
Thanks, Katie. Sorry, I'm trying to read the questions and I'm not sure how to make the screen larger. There's a question here, is there any information collected about the availability of food items among different populations at the urban and rural level and correlations to DDS? Actually, we have a little bit of information on how people are purchasing food and accessing food that we haven't analyzed yet. There's, of course, a little bit more information on things like people making bulk purchases, and maybe there's some evidence that especially during lockdown people are purchasing more non-perishable foods, the rice and oil and things like that. In a separate survey which we might present results for in October, we have a food vendor survey asking about both availability and prices. That's a sort of community level food vendor survey. I think there are no very dramatic stories in terms of disruptions to the food system, with only a few exceptions like poultry. Of course, poultry prices have been going up. But for the most part, most food vendors say that most foods are available with fairly normal conditions. Do you want me to move to go to another question, Katie, or would you like to switch it up?
I think that's okay. That was helpful on these initial ones. Maybe I could ask Elisa to comment. There was a few questions around your interpretation, whether it's around health education or barriers to diverse diet, the association of SBC, urban, rural. I'm putting pressure on the panelists to try to answer 2 or 3 in one go. Over to you, Elisa.
Yeah. So I will try to answer the Kelly and Duncan. I have a couple, 5 questions. So I think the first question from Kelly was related to seeing whether the effect that we find following up on the legacy sample are really due to health education or the inability and barrier to purchase diverse diet. So I want to point out that our sample were in a rural area, but within 2 hours from the main city. So we don't think it is a fair and good point. We don't think there is a problem of food desert in this context, but so we think it's more related to health education, and that's what we find. But that's an important point and should be considered in a different sample. Kelly also has another question on SBCC in general and what that entails. I think in our legacy program, it was a package with a lot of different intervention and groups and so on. So there is definitely scope to explore this package of nutrition related information and what exactly work, what the right frequency, whether we can exploit technology in that sense. So all the questions that she raised are important. I think there should be much more research on understanding like SBCC per se. And there were a couple of questions from Duncan that I want to answer. So as we pointed out, the evaluation was a randomized control trial. So to start with, the 3 groups were similar before the intervention. It was asking whether there was any correlation between perception of access to diverse diet and educational literacy. We did not ask perception. I'm happy to follow up with you, Duncan, on which type of question you have in mind. We did ask specifically access to diet diversity, like whether they eat food and which type of food in the last 24 hours. So we didn't look at that correlation, but I'm happy to follow up. And just as a last point on the program, there was another question from Sanjay, if I pronounced the name correctly, about like starting from the second trimester in delivering the program rather than the first trimester. I mean, the reason is that we need to be sure mothers are pregnant, so there is a lot of reporting issue of being pregnant but not actually being, to potentially get the cash transfer. So we do have in the sample everyone based on the baby, when the baby is born, and so we know who was pregnant at which stage, gestation age, going backward. But the program started in the second and third trimester, so it's correct that to look at the first 1,000 days, we need to follow all the period. Just the program needs to be delivered to mothers that are actually pregnant. I think those were all the questions assigned to me, Katie, so we'll bring it back to you. Thank you.
Well done. I would like to give Sophie the opportunity to do the same. There was a couple around rural, urban, which I think would be interesting to touch on. And then I'm going to give our government colleagues the opportunity to talk a little bit about the interministerial coordination and the SERP, how this links to the SERP. So over to you, Sophie.
I didn't see any question on urban specifically.
Oh. Let me see if
were
I
there
can
a question
find...
that you were breaking out a bit? So were there any specific question on the urban sample? I had one question on the sample.
Yeah, I didn't hear you there. The question was around the last study shows interesting behaviors around IYCF and mother nutrition. Do we have a similar study in a rural setting? And do we find the same patterns?
Is that the one you're thinking of? Or?
And this was more around, was this study, do we have a similar study in a rural setting? Do we find the same patterns around nutrition and after childbirth? Just comparing rural and urban. Sophie, do you hear me?
You can hear.
Katie, I'm really sorry. My connection is not very good, so I couldn't hear the question. I'm sorry, Derek. Maybe if you can answer that one.
Yeah, I think the answer is no. We don't have much data on that yet, because in the rural sample, they were sampled differently. They mostly have older children. Very few mothers in the rural sample had recently given birth. But I think there are previous studies showing at least that there were, prominent food taboos around the foods consumed after immediate childbirth. So yeah, I think the short answer is no. I think there were also questions about conditional cash transfers. I mean, I guess we're largely there thinking about food or cash for work programs, given that there's quite a lot of people with either no job or inadequate amounts of work in terms of selling their labor. Obviously it takes time to set these up, and there are some activities underway, but I will mention that from the community survey we're also running, we asked community respondents what they see as their two biggest priorities for their villages were, or their townships. And the two top answers were income relief, or jobs, and the second one was infrastructure, especially in rural areas. So it's possible that to some extent food for cash, food for work programs can address both of those issues to some extent. There were lots of more detailed questions on social protection implications, which I think I'm probably not qualified to answer, but we could possibly follow up by email with.
Yeah, and what I'd like to do now, just because we will lose our audience fast, but we also need to let our government representatives get on with the job of governing this country. So I'd like to very quickly just ask Cholin Tin very briefly to make a comment on the links to the social protection part of the SERP and the interministerial, and then I'm going to ask Ucha Shweilin to close for us, because I believe he will also need to go. Over to you, Cholin Tin.
And thank you so much, for this question. Yes, interministerial coordination, that is, very, important in responding, this, pandemic. As you know, we have, in implementing, social protection, programs, especially cash transfer programs, we have two platforms, for coordination. So one is, MS MPAN, as all of you are aware of. So that is the, multi-sectorial, plan for nutrition. And the second platform is, social protection subsector, working group, coordination group. So we have two platforms for coordination. But sincerely speaking, we also facing challenges, in using these platforms, because all these respective ministries and organizations, they are super busy with their own activities. But what we are doing is, based on the programs or activities that we are implementing, we have had bilateral coordination, or we have multilateral coordination sometimes. But both, especially MS MPAN is quite active, and we used to meet and quite frequently, and present what we are doing, and seek suggestion and from other members. So that is quite effective. At the same time, we are implementing our CERP programs and our regular program, and through bilateral and multilateral coordination. So that is the, I think that will be the answer for this question. Kitty, is that the answer for your question? Or
yes, that was perfect. That was perfect. Thank you on the MS MPAN and the SERP. So with that, I would like to pass to the Director General, Ucho Shwelen. I believe he's still with us on the line, and to give us some closing remarks. And to remind everyone that really so many questions came in, and we will share the questions and the answers with this group after the webinar, and we will also post the responses to that. Thank you everyone for staying with us this long. Over to you, Director General. Thank you for closing. There was a lot of very interesting questions that came in around how to do these kinds of surveys during COVID times, how to reach people, how to do it safely. Really some very interesting questions that we haven't had time to delve into, that maybe we can find some way. Derek, do you want to say anything in response to this question around doing it during COVID times while the DG sees if he can connect?
Yes, sure. Yeah, I think we are quite fortunate in that, of course, in Myanmar, phone ownership is very high. People are very comfortable on phones. We've, in this survey, I think, had much less attrition than expected, and which is quite amazing considering that many women are pregnant and also recently given birth, and yet they keep answering our phone calls, which is wonderful. It certainly is challenging in that you have to keep the surveys relatively short. And there's some evidence that phone survey responses can systematically differ a bit from in survey responses, but I think this survey has actually gone really well. It is important to pre-test as much as possible, and to make questions as clear as possible. But I think this has been a very good learning experience, and I think there could be a future for continuing phone surveys in Myanmar as part of more sustained monitoring and evaluation systems.
So would any of the panelists like to make any last words of something that you think was really essential to say on the study's forthcoming work?
Only that, yeah, there will be, both publications coming out and subsequent rounds. We didn't mention, but this survey is intended to be conducted every month for a period of 6 months, so that with the first round pertaining to June, and then all the way to December. So I think we have good scope to both track the extent of economic recovery, but also the impacts of the second wave, especially which that has affected Yangon in particular. So we'll certainly be hosting more webinars, but please also look out for publications coming out in the near future.
Great, thank you. Thank you also to Olinten for joining us for such a long period of today as well. We know these findings and the recommendations are very close to your heart, and indeed are your area of specialism. So with that, we thank you everyone for joining us today. The webinar and the Q&A and the studies and everything will be posted on the IFPRI site. and we will continue to engage with you to learn more about how COVID is impacting Myanmar and how we can support vulnerable households. Thank you all very much and have a very good day.
Okay, thank you so much.
Thank you.
Thank you.